sectional minority and trans and gender diverse, or TGD, individuals feel in their social context can be an important determinant of health and well-being. Support can come in the form of anti-discrimination laws, other sexual and gender minority peers, mental health providers who are affirming, and a variety of other forms. Research suggests that sexual minority youth who live in areas with more social support and less discrimination report less suicidality, and a study of sexual minority women found that those who lived in more supportive places also reported reduced internalized homophobia, being more out, and having more support from their community. However, most of this research has focused on sexual minority people with relatively little looking at the experiences of TGD people. This data comes from a study looking at the experiences of TGD individuals across 4 different states to understand the effects of socio-political context on health and well-being among TGD individuals. In this particular study, we examined how contextual support correlated with depression and anxiety among white and Black, Indigenous, people of color, or BIPOC TGD individuals while controlling for state of residence and age. In our sample, there were 109 white participants and 49 BIPOC participants. BIPOC TGD people lived in locations with more TGD supportive resources compared to their white peers. For depression, older participants, regardless of race, were less likely to report depression. There was a trend towards an interaction between race and current context, such that white TGD people had relatively stable depression across contexts, but BIPOC individuals in higher support contexts reported higher levels of depression. For anxiety, lower rates of anxiety were reported among older participants and participants from Michigan. The interaction between race and current context was not significant, but showed a similar pattern to the previous interaction, wherein anxiety in white TGD individuals stayed constant across contexts, but anxiety seemed to increase among BIPOC TGD individuals in higher support contexts. Overall, these findings suggest that BIPOC TGD individuals tend to live in areas with more support for TGD identities, but there was a trend such that among BIPOC TGD people, more contextual support was actually correlated with worse anxiety and depression. These findings pose the question of whether contextual support for their TGD identity is enough for BIPOC TGD people. Rather, it may be that BIPOC TGD individuals need support that takes a more intersectional approach to their identities, providing them support as a BIPOC TGD person rather than treating these identities as separate elements. We would like to acknowledge the large team that has contributed to this project, including PIs Dr. Jay Puckett and Zachary Dubois, site leader Deborah Hope, Richard McCarskey, and Robert Paul Schuster, and the many students who've contributed to the study. Thank you very much.